In this clip, we're going to talk about factors that destroy vitamins as well as the water-soluble vitamins. So heat can destroy vitamins. Thiamine is especially fragile, so the moral of the story there is to not overcook foods. Oxygen destroys the antioxidant vitamins A, C, and E. So a blended smoothie made with fruit juice would have, or fruit, would have less vitamin C than the whole fruit. For example, the headspace in a pitcher or in a bottle of juice has air, which has oxygen in it, and that would destroy some of the vitamin C. So you're not really supposed to keep a bottle or pitcher of fruit juice for more than a week. Another really interesting application, which seems counterintuitive because it seems like fresh would always be better, but fresh produce that's been sitting out or has been shipped for a long distance will have less antioxidant capacity than frozen or canned. Fruits that are frozen right at harvest. Fresh would be the best, fresh picked fruit would be the best, but that's not, and vegetables as well, but that's not always possible. Okay. Another factor that destroys vitamins is alkali, and again, thiamine seems to be one of the fragile vitamins again. Baking soda is an alkali, and it's sometimes added to beans to soften them, to shorten the cooking time, so it would lose some thiamine. It's also added sometimes to green vegetables, especially if they're going to be held, for example, at a cafeteria line for a long period of time. You can see the broccoli on the left is nice, bright green and appealing. On the right is kind of an olive brown. That's what occurs if the broccoli is held, or something that's green is held for a long period of time. So you don't want to use, even though it's prettier, you don't want to use baking soda to brighten up your green vegetables because that will destroy some of the thiamine. Now, light destroys riboflavin, which is one of the B vitamins. That's why milk is now in opaque or translucent cartons rather than those glass milk cartons that used to be delivered to people. Now, there's a concept of enrichment and fortification. Enrichment is adding nutrients back to a food that were taken out in the milling process. For example, rice is milled. So thiamine, riboflavin, niacin, and iron are removed when grains are milled, but then they're added back to the level that they would have been originally. Fortification, on the other hand, is adding additional nutrients to a food, like cereals are often fortified with vitamins and minerals. Cereal grains are now fortified with folate, not just breakfast cereal, but all cereal grains, or most cereal grains, are fortified with folate. Now, one exception is that gluten-free breads and pasta are generally not fortified with folate. And we'll talk more about folate later and talk about why they started fortifying with folate. So we have two classes of vitamins, water-soluble and fat-soluble, and we're going to talk about the water-soluble vitamins first. The water-soluble vitamins are the B vitamins and vitamin C. There are 8 B vitamins, and they have different functions. Now, pantothenic acid we're not going to talk about at all because there's no documented deficiency and it's widely spread throughout food. Biotin you may have heard of. It's the vitamin that's in hair, skin, and nail formulas. They think it helps, some people think supplements will help your hair grow or your nails grow, and actually it won't unless you're deficient in biotin. Some people if you eat a lot of raw eggs, you're at risk for biotin deficiency because raw eggs have a protein in the egg white called avidin, or a substance in the egg white called avidin that binds biotin so it's not absorbed. But biotin is generally not something that we see a lot of deficiencies of. So we'll talk about some of the rest of them, but remember I gave you resources for detail on a lot of these vitamins that we're not going to talk about in detail in these video clips. Vitamin C is also called ascorbic acid, again, an antioxidant, and we'll talk about that in a second. So with the water-soluble vitamins, excess excreted in the urine, so they're not as likely to become toxic as the fat-soluble vitamins that can't be excreted in the urine. They do need to be consumed daily because they're not stored to a great degree. Fat-soluble vitamins are stored pretty well in the body, so you don't have to have fat-soluble vitamins every day in the diet, but the water-soluble vitamins you don't store to a great degree. Another thing about the water-soluble vitamins is that they can be lost in cooking water. Especially if you chop things up really fine, there's more surface area for loss of the vitamins, but they leach out of the food in the cooking process, or when you cook in water. So the moral of that story is, if you're going to boil fruits and vegetables, do it for the least amount of time possible to preserve the nutrients, or use another cooking method. Steaming and microwaving actually are cooking methods that result in the least vitamin loss. Now, thiamine, riboflavin, and niacin are vitamins B1, B2, and B3 respectively. They're used extensively in energy metabolism. For example, the conversion of carbohydrates to energy. The surplus is lost in the urine, so they typically don't become toxic unless you consume a huge amount in a short period of time. They're found in rich breads and cereals, and there are certain ones that are found in higher amounts, or certain foods are highly rich, like milk is a good source of riboflavin, pork is a good source of thiamine, and brewer's yeast is a good source of niacin. Now, as far as a thiamine deficiency, alcoholics often have a thiamine deficiency. And I saw this recently in one of my hospital jobs. It's lost in the urine. Think about when you consume alcohol, alcohol is a diuretic. You pee a lot. So you lose a lot of water-soluble vitamins and actually minerals as well when you consume excessive alcohol on a regular basis. But thiamine deficiency is really apparent in alcoholics, so we always give them a thiamine supplement. We also have seen thiamine deficiency in some people who've had gastric bypass surgery because a lot of their intestine is removed, which is their absorptive surface area. And if they don't take their supplement, they're at risk for a lot of deficiencies, including thiamine. People with diabetes are actually at increased risk for thiamine deficiencies, and a lot of people, even people that don't work with diabetes, don't know this. But thiamine is needed to metabolize glucose in the cell, and when there's excess glucose in the cell, there's a particular pathway that the excess glucose goes through that needs a lot of thiamine. So people with diabetes are actually at increased risk for thiamine deficiency. The symptoms are neurological, peripheral neuropathy, that is a numbness and tingling in the feet and hands, muscle cramps, and these muscle cramps can be severe. In people with alcoholism, their toes cramp up, and so do their ankles and calves, and it's really painful. And then long-term thiamine deficiency can result in dementia. So as far as niacin goes, I'm not going to ask on your exam for the recommended amounts, but anyway, an excess intake of niacin over 35 milligrams a day can result in basically hot flashes, flushing of the skin, itching, nausea, liver damage. A high dose of niacin is actually used as a medication for people with cardiovascular disease because it can reduce the LDL and increase the HDL. So it is used as a drug. Now that we have statins, I don't see it used as much as it used to be. Folate is a really important vitamin. One of its functions is to convert homocysteine, which is a molecule in the body, to methionine. Homocysteine is an inflammatory molecule, so a lack of folate, which is needed to convert homocysteine to methionine can result in inflammation and increased risk for cardiovascular disease. So here you see the pathway. Methionine can be converted to homocysteine. Homocysteine can be converted back to methionine. Homocysteine is not converted very well back to methionine with the lack of folate, so this inflammatory molecule builds up. So a deficiency of folate can also result in macrocytic or megaloblastic anemia. Macro means big, cytic means cell, so you have really big red blood cells, but not very many of them. Inflammation of the tongue with loss of taste buds is also a folate deficiency symptom. You can see that red tongue. The reason it's red is because the tongue is a muscle, and without the taste buds on it, it appears really red. Folate deficiency can result in poor growth and a depressed immune system. So here's an illustration of why people or how macrocytic anemia develops. So you have a red blood cell precursor, that's the blue one, and when folate is adequate at the top, the red blood cell precursor will divide normally. Without adequate folate on the bottom, the red blood cell does not adequately divide, so you have a really big misshapen red blood cell. Here's the RDA for folate. Foods like breads and cereals are fortified with folate, and the reason for that is because if a folate deficiency or a lack of folate increases the risk for neural tube defects in pregnant women, which I'll show you in a second. The food sources of folate, oranges and green leafy vegetables. In fact, folate got its name from foliage because foliage is green. Okay. So when I was creating this, I thought about that new fad diet, the carnivore diet, that says you should not consume plant products at all, only meat. And I worry about folate status for people who adopt that fad diet, the carnivore diet. So low intakes of folate or folic acid in pregnant women are associated with neural tube defects. One of them is spina bifida. Your nervous system, when you're a developing fetus, starts out as like a flat plate, and then it curves around to become a tube. The top of the tube becomes the brain. The lower part of the tube is the spinal cord. Well, with a folate deficiency, that tube, a portion of that tube doesn't close fully, and that causes a lesion in the neural tube. In spina bifida, depending on where that defect occurs, that will affect the symptoms. Below the site of the defect will be paralysis. So John Cougar Mellencamp, whatever he's calling himself these days, he actually has spina bifida. His lesion, though, was so low on his spinal cord that he didn't have any paralysis. He's a singer. He was popular back in the day. His songs include Jack and Diane, Pink Houses, Hurt So Good. You may or may not remember him. If the neural tube doesn't close because of the folate deficiency at the top of the neural tube, that results in a condition called anencephaly, where the brain doesn't develop. These babies normally die shortly after birth. Some of them do live for a little while. Toxicity of folate, there is no known toxicity, but the one concern is that excess folate can mask a vitamin B12 deficiency. So you can have a vitamin B12 deficiency, but if you have a ton of folate, the B12 deficiency won't show up until it's too late. And that's a problem because a B12 deficiency results in nerve damage that's permanent. So there is a limit on the amount of folate that's allowed in supplements, and that's 1 milligram per tablet. Since this has gone on for almost 15 minutes, I'm going to stop this for now, and I'm going to continue with the water-soluble vitamins in the next video.